And we begin reopening the county and working on key goals and strategies to make sure that is done in a responsible manner. And new testing sites by Dr. Yolanda Martinez, the Health Services Director for Orange County. New information from the Department of Health here in Orange County. Information on enforcement, schools, and the courts from Orange County Sheriff John, Judge of the Ninth Judicial Circuit, respectively. We start with Orange County Mayor.
Once again, last week was quite very active activities. I have three goals really for this week moving forward. One is and I believe we receive as a result of the testing is important to those of us in the public sector making decisions. With the adequate personal protective equipment, and we look to receive the supplies of hand sanitizers and masks this week that we should be able to redistribute to our small businesses. And then the third goal this week is get final recommendations from the task force to support the Phase 1 reopening standards and help. And Phase 2 will happen at some point in the future. It could be a month away from now or beyond, but we began that planning process now. On Friday, I signed an executive order requiring social and face coverings for places of business. The executive order states that employees and patrons of businesses that require employees and patrons in 6 feet of one another, they must wear a mask, a face mask, or covering unless the wearing of the patrons impede the patron's service, in which case only the service provider must wear a mask or face action. For the rest of our county residents, I strongly encourage you to wear a face mask or covering when out. Entire order on our website at ocfl.net/coronavirus. Friday night, I sent a letter to Governor DeSantis, nail salons and hair salons to be part of the Phase 1 reopening. I believe this matter of hygiene and the shops and salons should be allowed to open. Within hours after sending the letter, from the governor, and we were able to successfully schedule a meeting and had a roundtable discussion with personal service or personal care business owners, as well as people participating in that event with us, along with several of our small business owners who represent shop nail salons. The owners, from my perspective, did a job of case to the governor and why they should be allowed to reopen. I do see salon health of our community, as we all have to be concerned about our personal hygiene, and so if the interaction went well, the governor seemed to suggest how to move into the Phase 1. The question was when will that happen? With and have conversations with his staff in Tallahassee, and then hearing more from the governor. We remain optimistic that perhaps Friday be such businesses to reopen. Orange County now 30 cases, 35 people have died as a result of the disease. Tested COVID-19. Over the last 2 days, individuals have been testing at the very 0.1%. Dr. Pino will get more into that with you. At some point, we've seen a positive rate as high in this county as 5%, 6%, 8%, but below 1%. You know, I think overall that means that yes, those seem low, and as we reopen businesses here, we want to continue monitoring those numbers to ensure that they remain low. Otherwise, we'll have to make some adjustments going forward. So I appeal to our residents here in Orange County that it is important that they continue to embrace the social distancing that we put in place. It is all of our best interest to be able to do so as we go forward. This week, 2 sites operated by the Orange County Health Services will be open Monday through Friday. They are in 2 of the zip codes for the highest numbers of the coronavirus cases that we have in Orange County, of course, 32822 and 328. You will hear shortly from Dr. Yolanda Martinez, the director of our Orange County Health Services. You can also go to net/coronavirus for other locations that we will be doing testing here within Orange County. And many of you know we launched the hashtag 407-day in support of our local restaurants. It was and today I'm happy to announce a new campaign in partnership again with Visit Orlando, in which we will launch 407 dates. For the next several weekends, Visit Orlando will promote virtual dates, and your significant other can watch together online in our community and still stay socially distant, but not from each other. On the order a romantic meal, eat it at home. You know, even though some restaurants will be open, but we want you to enjoy. It is important that we take a moment just to relax and be ourselves. Order takeout these days, and I always look forward to evening in D.C. Just the 2 of us. Our kids, fortunately, are for them. But we are seafood lovers, and we like to enjoy place for takeout these days is Bonefish. They're in the Dr. Phillips area. But participate at orlando.com/to-go. Visit Orlando. Post some of those photographs of yourselves and your restaurant takeout with the hashtag again. 0 date that I offer at this time. I'm going to turn the microphone over to.
Certainly, we all know that COVID-19 has impacted every. So today marked the start of phase 1 of the statewide reopening. And over the last few weeks, the city's been working with local businesses to get them on a path to recovery. We were able to hear from business owners and learn about what they believe they needed to help their businesses reopen and rebound. As a result, today we announced the immediate actions that we are taking to allow businesses within the city limits to temporarily expand their operational space and market their businesses outside. These opportunities include allowing businesses to expand retail sales into side areas like parking lots, authorizing businesses to use small tents to accommodate sales and to use extra banners and signage for marketing. Additionally, on Monday, our next City Council meeting, businesses to safely expand sales and restaurant seating into public rights-of-way. So, a program that will cover the cost of downtown park garages and on streets to bore. And all of those will be done without the need of any permitting. Those changes will help our businesses open and operate safely. Mayor Demings has to increase the COVID-19 testing. So today, through a Goldenrod Road, site will be open 6 days a week, Monday through to 1. Here, you can make an appointment for testing by visiting myquest.com. As a community, we're able to be today, putting it weeks of the last 6 weeks, but we have to remember the entering this and continue to be responsible by practicing physical distancing, wearing face covering, washing your hands, and keeping good hygiene habits. We can't be complacent, but together we can continue on this responsible path and ensure the steps we're taking to protect health and well-being for all of us. I'm not sure which doctor I'm supposed to call on. Dr. Martinez.
Thank you so much, Mayor. Good afternoon to everybody. So as Mayor Demings mentioned, I'll provide a brief of the 2 sites that County Health Services has been operating since last week. On the 3 days that we operated, Wednesday, Thursday, Friday, 978 residents conducted 978 tests. We're located at the Ventura. We're very grateful to Orange County Public Schools for allowing us to be there, and also at the Youth Sports Complex located in the 32824. Of the 978 tests that we did last week, we already received results for 525 of those, and 4 so rate, as the mayors have been saying, and as Dr. Pino has mentioned in the past. I think it is important, as both mayors have mentioned, as a community, we have a very low positivity rate. We should not let our guard down. What this means is that in guiding our community, they took very early decisions that were very vital to our community, and our community has listened. Our residents have followed the guidelines. This is the time that we must continue to wear our masks when we are in public, observe social distancing. And I know Mayor Demings has said this before, this virus is very deadly, and it's looking for the right circumstances to stay cautious and continue what we have been doing so far, which has worked relatively well for our community. Of course, those we have lost as a result of the virus. We are very pleased at the response of the community that want to book an appointment at the Ventura Elementary location. You need to go to the ocfl.net/Ventura, or if you want to book South Orange Youth Complex, visit the ocfl.net/South Orange. From 9 a.m. to 4 p.m. Register to be, we're still wanting you to go over there. We're testing individuals 18 years of age and older that test have symptoms. So in that case, we're not necessarily following the CDC guidelines for some of them to be tested. Again, let's continue doing what we have been doing so far. We're doing remarkably well as a community. And distancing. And with that, I'd like to pass it over to Dr. Pino.
Can you put it up?
It's a pleasure to be here. Thank you, the press, for being here with us. Or one of cases with a 4.9 positivity rate. This is a letter that we received at the health department from Orlando. Trouble of finding paper, writing, it's quite beautiful. We send it around. Really, her note says, dear health care helpers, thank you for keeping everyone healthy and safe. I hope every single one of you that works there are not getting the virus that is going around. I am so thankful for the helpers that work there. I appreciate you being there every single day. Love, Avery. So this is Miss Avery. Thank you very much for your note. It really touched the hearts of many of our workers at the health department, and we made these thank you to all healthcare workers in Orange County. 29,000 residents have been tested, as the mayor said. I want to highlight the point that when we talked to you last Friday, our positivity rate was 5.4. Today is 4.3, and the last one day was below 1%, and yesterday was a little bit above 1%. As I said this morning in our meetings with the task force, the county is in good shape to start. How fast are we going to start phase 2, or how fast are we going to meet the prerequisites for phase 2 as set up for, depending on how well we implement phase 1 and how careful are we with our washing our hands, our nose, and keeping social distance when it's possible. And those elements are critical for us to continue. Take the precautions that we need during increasing social interaction. We could go back to where we were. On that, a new fatality was added to our list. Our condolences to her family. 80th Hispanic. We don't know the exposure. We don't know any pre-existing conditions. And the person on that, we have a new data to offer you. Orange County so far has been on asymptomatic people. 10% of all positive tests, asymptomatic people, which give us an idea of how critical. That's what is so important, that those precautions that are being put in place by the federal government, the CDC, are so critical to follow. We don't know who may have it. So it's important to protect. During the last 2 weeks of our mobile testing, we tested for a percentage of 1%. And 0.7. the Camping World, 391 individual, 6 positive. On Friday, we tested 428 individuals at Blanchard Park. From that test. Again, I want to encourage and congratulate also our community for taking all the steps needed to control this pandemic. I think we are in good shape to start our phase one. And again, how good our shape is going to be for phase two will depend on what we all do together to fight this pandemic. With this, I would like to introduce Sheriff Mina.
Thank you, Dr. Pino, and good afternoon. So there seems to be some confusion on how some of the restrictions in both local, state executive orders will be enforced as restaurants and other businesses have begun to open. So I just want to clear a little bit of that up. So we, believe me, law enforcement in this community knows how businesses to be up and running, and for Central Florida economy to get back on track. But we just want to let you know the Orange County local municipal police departments aren't going to be proactively going into these businesses and these residents in the restaurants or other places of business, whether they're following the orders. But if anyone believes that any of the licensed business operating contrary to the governor or the mayor's executive order enforcement, those businesses can also be reported to the Department of Business and Professional Regulation complaint filing portal /DBPR. I want to be clear, our residents can always call law enforcement. We will respond to calls as we have home order has been in place. In most cases, our deputies, our law enforcement officers have been able to speak with the people. And I also want to say it's up to everyone as individuals and business owners to be responsible for our businesses. What we are most concerned about are the gatherings of large groups. So if you go somewhere, protocols are not being followed, especially if they are egregious violations. By all means, reports if you don't feel safe because of that. But we want to know about that so we can stop it before it starts. New normal. I want you to be sure that the men and women in law enforcement remain committed. Crime is down in Orange County during this pandemic. There are still victimized people in our community, so that's what we want to focus on. We'd rather not focus on in a moment. I'm going to introduce Dr. Jenkins, but do want to let her know that our school keep an eye on those schools just in case there are any unwanted visitors. So
graduation certainly be our joy and our heart's desire in July as soon as possible. The later we wait, we believe we might know better whether or not we're able to have those in-person graduations. I know it's the hope of our young people and of our families. Thirdly, this Wednesday, honestly, we have over 25,000 employees. A small percentage of those employees will be returning to work that cannot continue to telework or may not have had the ability to telework to start with, but they are going to help us close down this school year. Overdue work orders, 400 need to be done. Buses need to be serviced for our eventual return to servicing. And we have to continue our grab and go program, which staffed largely by a temp service, helping us keep those meals going to our young people. Grab and Go, by the way, has reached just over 2 meals being delivered to our young people. So employees will be coming back on Wednesday, those who have been notified. We will still have office hours for Monday, Wednesday, and Friday of this week. Those employees are returning on Wednesday. Next week, we will return to a Monday through Friday. Our hours will be from 9 a.m. to 2 p.m. All of our work sites will, of course, practice CDC and the mayor's guidelines as reported. We expect our employees to be in safe. And then lastly, our mental health services team continues to have a helpline available for parents and for students Monday through Friday. Phone number is 317-3694. Of course, you can always call the 211 helpline if you're experiencing an emergency. Website, ocps.net, our Facebook or our Twitter sites for the latest updates. For all of your support as we wind down this school year, and thanks again to all of our wonderful teachers. Now to cheers.
Thank you, Superintendent, and thank you, Mayor, for continue to communicate with our community about the important things that are going on at the courthouse. The health and safety of all of the people who work to serve inside of the courthouse, as well as to those people who come to about the recent order from Governor DeSantis that effectuates a partial reopening of the state. And I wanted to be clear that the Governor DeSantis's order does not impact the operations at the courts or the courthouses. Those are unique operations. We are governed by the Florida Supreme Court and its orders. And as a result, we will continue to follow those orders and will continue to limit access to the courthouse to only those proceedings that are defined as essential by the Florida Supreme Court and that are critical to the state of emergency or the public health emergency that we currently find ourselves in. Those services, just to remind you, and this is through May the 29th under the current Supreme Court order, the things that we are doing as essential services or critical proceedings are first appearances for folks who've been arrested, arraignments, hearings in motions to set or modify bail, juvenile delinquency hearings, and juvenile dependency shelter hearings for injunctions related to the safety of people, hearings on petitions for risk protection orders, Baker Act and Marchman Act hearings, kinship hearings, and hearings on petitions for extraordinary writs as may be necessary to protect individuals' constitutional rights. Proceedings that are essential to the public and health emergency. That includes violation of quarantine or isolation orders, violation of orders to close public or private buildings, and the enforcement that remains in effect here in Orange County. Essential services that are continuing. However, they are continuing remotely through video conference and through telephone conference. If you have a hearing that has been scheduled and canceled, you will be contacted. Notice will be given to you, and you'll have an opportunity to means where possible. Additionally, court users are always free to file pleadings through the court's e-portal, which is available. Just this afternoon, the Supreme Court entered another administrative order extending the time through which we will not call to the House. That extension is through July the 2nd at this point. So there will be no jurors summoned between, as has been the case since the beginning of the pandemic now. We are continuing to do everything that we can while safeguarding the health and welfare of our community. So I want to express my appreciation information we've engaged, and remind you that the circuit has a dedicated COVID-19 website or page on our website, or copies of all of the orders, as well as any other additional information that would be necessary for you. Updated and fastest way to update information, we encourage you to follow us on Twitter or Facebook at 9th Circuit FL. Thank you, Mayor.
Okay, we'll take a few questions. As you can see, we had quite a number of speakers this afternoon, so we will endeavor to answer your questions as soon as we can.
Hi, Eric Sandoval with News 6. Question for Dr. Pino, and maybe Dr. Martinez as well on this. Dr. Pino, you had mentioned that 10% of the 10% of the cases were asymptomatic in their testing. Can you speak to the people who may be watching this who think, I feel fine, have it, why should I go get tested?
So we think really, as I said before, that asymptomatic an important role in the transmission of the pandemic. Why is that? Because if you don't feel sick, you normally will not stay home, you will be in contact and going out and about. And as we go along testing, assisted living facilities, as we increase the testing over there, we have found that there is a significant number of people symptomatic. Probably even when we test more and when we get into antibody testing, we will realize that that number is quite large. This is that we have to put in place. Why is important? Because, as I said before, we have once it's asymptomatic and it's not experiencing fever, it doesn't feel ill, it doesn't look ill either. Normally, even within your family. So it is important that we keep that. And another data, probably the most important, that like 93% of all our cases have recovered in our data. That's set. Those are the initial cases, and now as a number of new cases decrease, is that recover will increase. About 93% of our cases have recovered.
Are you urging everybody to go get tested?
Everyone who wants to be tested should be tested. As everyone should know the results. And what is also important for people to realize when they get tested, and that's the other coin of the asymptomatic people, is that now because you are negative, it doesn't mean that everything is okay. You can acquire it tomorrow. You are negative today. So it's important that even when you are negative, you continue to take those precautions to protect yourself from getting infected.
Buenas tardes, Félix Pirela de Telemundo. Doctor Pino, doctora, tengo dos preguntas. La primera sería, hoy comienza la reapertura de ciertos negocios, por ejemplo, como restaurantes al 25% de su capacidad. ¿Hay algún que ustedes tengan preparado de haber un repunte tomando en cuenta que tenemos aproximadamente 20 días con los casos bajando? Si llegara a haber un repunte con esta apertura de algunos negocios, ¿hay
that's a very good question. There is not a plan B per se. Like, we will have, la pregunta fue en español. Tendríamos que ver, no hay un plan B, tendríamos que ver qué es lo que está sucediendo, cuál es lo que está pasando, está esto limitado a un lugar específico, cuáles son las condiciones de ese lugar, y nosotros responderemos a adecuadas, las que hemos utilizado anteriormente, y otro grupo que pueden contribuir a contener y que pausa si es necesario. También otra cosa que vamos a tratar de hacer diferente es empezar a hacer pruebas a las personas que vamos a contactos positivos, respondiendo a la necesidad de encontrar más personas asintomáticas. Saying the question in English, the question in Spanish translated to English was if we have a plan B in case that the answer was that we don't have a plan per se, but we have all the measures that have worked before. We'll have to do a lot with the context of the increase of the infection. Where is that happening? Is that located to a place? Group of individuals, and we will act accordingly. And part of that effort also to contain any possible in sync with the role that we think asymptomatic people are playing, is that we are going to start testing when they may be asymptomatic. Anyone that has been in contact with a positive person that may come in contact with us, so that we offer that opportunity to find more asymptomatic people out there.
La segunda pregunta, el balance que tuvieron en los primeros 3 días de pruebas en los puntos más calientes, que en su mayoría son comunidades hispanas, como el 328.
Perdón, ¿cuál es la pregunta? ¿Cuál es la...?
El balance que tuvieron en cuanto a pruebas, cuántos casos positivos tuvieron, cuántas pruebas en total hicieron en los primeros.
Claro. 978 personas recibieron pruebas en los 3 días y de esas 978 hemos recibido resultados hoy de 525 personas. De esas 525 personas, 4 fueron positivos. Así que el grado de positividad es bajo, pero queremos que las personas sigan haciéndose la prueba. The question was of the 2 sites, and I had already provided this information, of the 2 sites that we have seen in the last 3 days, in 32822 and 32824, what was the total of patients and what was the result of the test? We saw 978 in the 3 days of testing, 525 results, 4 were positive.
Other questions?
Buenas tardes, programa 100.7 FM. Mi pregunta, tengo 2 preguntas. La primera, ¿cuál es el mensaje para la ciudadanía en general que aún los números de casos del coronavirus puedan incrementar y si puede haber una recaída? Esta pregunta puede ser para el doctor Pino o para la doctora.
El mensaje a la comunidad es que tenemos que seguir vigilantes y lo hemos repetido y lo hemos dicho desde un principio. Ha sido relativamente suerte en nuestra comunidad, ha sido el resultado de decisiones que se tomaron temprano y de que la comunidad claro que las personas que hemos perdido desafortunadamente como resultado del virus, pero tenemos que seguir vigilantes, tenemos que seguir haciendo las cosas. Tenemos cuidándonos de no estar muy cerca de otras personas, de si tenemos algunos síntomas, inmediatamente visitar a nuestros doctores, cubrirnos la cara, lo que estamos haciendo, tal vez un poquito más y seguiremos en el camino correcto. The question was what message we're having and so that they continue working towards eliminating the virus. And they've been repeating over the last few weeks that we have been here and asking the community to observe social distancing, to wear masks, to use good hygiene when washing their hands, and we're asking them to redouble on that. And also the fact that, as I mentioned earlier, the leadership of the community of the county took decisions early on has helped us sort of navigate through this better than we would have otherwise.
Gracias.
Dr. Pino.
Mi siguiente pregunta es, la Junta de Trabajo para la Recuperación Económica está justamente trabajando en campañas para educar al público sobre procesos y procedimientos de salubridad y seguridad. ¿Están considerando ustedes a los medios de comunicación en general para propagar este mensaje y también a los particular?
La respuesta es claro. ¿Cómo no? Tendría que ser Y no creo que solamente los hispanos, hay otros grupos muy importantes en la comunidad que también en otras leyes recibir la información y estoy seguro la van a recibir. Todo lo que viene del Departamento de Salud es también traducido en las lenguas que se hablan más. Are we going to engage with the Latino media and the media in general as we develop campaigns to educate on they should take? And the answer was, of course, and of course the Latino media is going to be engaged, but minorities in our community that speak a diverse range of languages that will, of course, will that demand.
Stephanie Quinu with Spectrum News 13. Mayor Demings, I had several try and start phase one. Can you talk about the potential losses that the county might be looking at, or looking at cutting services or staff because of this?
At this point, most of the economic impact on Orange County government to date is well within. However, moving forward, there's no question that this event, and so we will see a decline in our revenues. So the guidance that I have given us is who derive a portion of their budget from the taxpayer dollars. New positions, with the exception of those with life, health, and safety or wellness types of job responsibilities, and we're looking at 0% pay increases next year, with the exception of those that we are contractually obligated to do. So we're doing those belt tightening things at this point.
A large part of that revenue does come from conventions. The county has lost hundreds of millions of dollars, obviously, since conventions had to be canceled. So where does that money typically go? How is it distributed? And now, because of that loss, what could be on the chopping block? I mean, what are your feelings on that?
Fortunately, we have very healthy reserves to be able to sustain and maintain the convention center. And so we were running ahead of where we had been up until March. The revenue, optimistic that as we begin to reopen, that we'll recover some of the revenues from the tourist development tax, but it is unlikely that we're going to fully recover during this or the calendar year in question. So we will see the most significant impact on our budget, perhaps not in fiscal year 2021, but the fiscal year 21-22. So that's because of how the properties occur. The valuations were essentially on the books in January of this year. You will see our taxpayers tax at what the value of their properties were as of January. But that does mean require to look within our respective budgets to look at being very measured in our approach to expand our budgets significantly. Okay.
Lauren Seabrook, Channel 9. Mayor, I spent a signal with restaurant servers who were going back to work today. Many of them were very nervous about going back. They felt like they weren't prepared. And they basically were told if they weren't coming back to work today, they were going to lose their job. They didn't feel like they had a way. There wasn't any representation on the task force of some of the servers who don't really have a choice in coming back are the rights of these servers?
The business owners are responsible for their employees and they've been service. Some of them have been wait staff and what have you. So it's very difficult for anyone to know. So it had to be a limited number of people. Going forward, it's really up to the individual business owner to make the types of decisions about whether to re-engage, to open or not to open. What we wanted to do was give all of the business community ample time from the point that the decision was made by the public sector to that they could reopen. But the governor made his decision. And so it wasn't a lot of notice from that decision-making point to the point that business is open. There's that a business must open today. You know, of course, they were able to open it as of 12:01 a.m. today. If the business was not prepared, simply could have stayed closed down. If those employees didn't return to work, that business wouldn't be able to open. So getting into the employee kinds of relationships, it's kind of disheartening to hear that the employers were not sensitive to the employees, which is why we have endeavored to, through our Economic Recovery Task Force, to give as much lead notice as we possibly can before you get phases. So I would say to that employee, that's something that they should take up with their individual employer. Other questions?
This is for Dr. Pino.
Dr. Pino?
Thank you, sir.
The information about her is interesting. I don't know if you know why she died or what the cause was.
I know. So in the health department, we have a principle. If you don't need to know, just don't know it. Because the HIPAA is the least likely you are to disclose HIPAA information inadvertently. You could. I don't know. I really.
My question, which is exactly who do you want to be tested? Everyone? Or is there want to? What are we looking for? And the next part of that is, do we have enough tests to do that?
In the right sequence. Who would like to be tested? So another mode of the pandemic response. So now that we have reduced community virus level, or immunity, and I think for this one they probably will call it the same, and it can be calculated, the amount of virus that is out. And groups that we are very interested in, healthcare workers is super important to test as many. And some of our hospital systems are doing just that right now. Already being exposed so that you know who can really get close to other patients. That's a group. I will be very interested in the homeless, people who are experiencing homelessness, because they live in a congregated environment, because they normally don't access healthcare services. Although we have healthcare, the healthcare network for the homeless, we are working with them to increase testing at shelters. We also would like to see first responders to be tested as much as we can. And we would like to see all, if people living in assisted living facilities, to be tested. And we now voluntarily, for those who want to participate, the Department of Health, in coordination with the National Guard, is conducting testing in some facilities that have agreed voluntarily to test all the workers. And in some facilities that we reported a few weeks ago, they were on their own, they tested everyone. Residents who were asymptomatic. And I think that put that facilities in very good shape to control the environment, to isolate, also be able to protect those who were healthy at the time. And of those 6, only 1 developed symptoms. A couple of it was diagnosed. So again, this is to the importance of asymptomatic people. And we should try to test as many people as going to be very relevant for people who are hospitalized, for healthcare workers, for first responders, people experiencing homelessness.
Okay, we're going to do one more question, and then we're going to conclude the press event this afternoon. One more question.
Comes to Orlando Business Journal. Mayor, have you gotten a chance to see businesses reopen? What have you seen or heard so far in terms of compliance to the guidelines?
Okay, I go into several businesses that recently reopened, and overall I saw significant compliance. You know, they things in a very safe and healthy way, so that's very